Hello, my name is Tamika Seaton, Executive Director of the Florida Lyons Eye Clinic, and today we're going to give you a tour of the clinic located right here in Bonita Springs, the only free eye clinic in the state of Florida. Now we're inside the eye clinic. This is the reception area. This is the first step. This is what patients see when they first come to the eye clinic. Over the phone, they would have already qualified for our services, which they can't have any health insurance, and their income has to be below 200% of the federal poverty guideline. However, there is one exception. Kids who are on Medicaid under 18, we're able to see them because of the shortage of pediatric ophthalmologists in the area. We actually have 2 on staff and 1 neuro-ophthalmologist. The patient comes in, they check in. If they're new or haven't been here in a year, they have to complete an application again, and then they're ready for medical pre-testing. We just toured the reception area. This is the seating area where the patients wait for their appointments. There's a total of 16 chairs here. And also we have a children's play area where we have assortment of toys, trucks for boys and girls. We have lots of little toys and an even really cool rug. And even Lion here. Say hi, Lion. Hi. The Lion looks over everyone as they wait for their appointment. So now we're in the medical pre-testing stage. As part of medical pre-testing, the patient has to get what is called auto-refracted. This is an auto-refractor. It takes a picture of the left eye and the right eye, and it gives the doctor a start when the patient goes into the room and the doctor does something that's called refracting. And that tells if you need glasses, and if so, what does that prescription look like? What is the strength on each eye? This machine is the puff machine. It's just that. It puffs in your right eye and your left eye. And it measures the pressure in your eye to see if you have onset of glaucoma. If you have a lot of pressure in your eye, you may have glaucoma. That's why it's very important if you're diabetic to get your diabetes under control, take your blood pressure medication if you need to lose weight. Exercise, diet is huge, and that will help a lot with preventing blindness. Well, the next step in the patient process is to take their blood pressure and heart rate. So the patient would sit down. A volunteer would take the patient's blood pressure by putting the cuff on their arm. Usually we use the right arm. And just press start. The machine is automated. It tells the patient's blood pressure and heart rate. We record that as part of our pre-testing and our medical history, so that when the patient sees the doctor as part of our comprehensive eye exam, we know all about the patient and where they stand health-wise. This is the 4th step in medical pre-testing before the doctor sees the optometrist or ophthalmologist. I like to say this room helps us start to break the cycle of blindness, poor vision, and poverty. Because if you can see better, you can go to school, get an education, see the board, do well, read, write, and just have a better quality of life, and you're more independent. So in this room, we take the patient's history. If they have a list of medications or their medications, we ask them to bring that with them. Also, the monitor here, we check the patient's vision with their corrective lenses. That's if they have glasses. And without their corrective lenses, glasses, or contacts, we have them read this up close to see what is the lowest line they could read. And that helps determine where they're at with their vision before they see the doctor. We use this machine to read the patient's prescription glasses or readers. That's a start. Also, after each patient comes in, they do the medical pre-testing, and then they're dilated so that the doctor could use the slit lamp in order to see their eyes. So once the patient is done with their pre-testing section, they're ready to see the doctor. The patient would come in the examination room, sit down here in the chair, and the first machine the doctor would use is called a slit lamp. This is the slit lamp. The patient will actually be sitting here. The doctor would be sitting here. The patient would put their chin here, forehead closer, and this is a microscope. It's used to see internally in the eyes to see if there are any onsets of diseases, or if there's fungus in the back of the eye. We may order a fundus photo, and we'll show you that room. After the doctor sees that, this is called the refractor. Remember the other room in pre-testing? We had the auto-refractor. Well, the auto-refractor gives the doctor a start on what lenses to start with. And the patient would look in here, and the doctor would go through the different lenses to see which works. in order to fill the prescription for the patient's glasses. After the patient has been through pre-testing, had an examination by the doctor, and the doctor sees something that they want a picture of to get a closer look, the next step would be to this room. This room is where we have our camera. This camera takes fundus photo pictures, both internal and external pictures. So for a patient that has pterygium, the doctor would want an external photo to see what level of pterygium it is. A pterygium can go from anywhere to 1 and 5 being the most severe, with the tissue almost covering the eye and blinding the patient. So with external photos, the picture would sort of be out. Internal photos will go in with the picture. After that, if the doctor determines the patient may be have high blood pressure or diabetic, and the puff machine resulted in high pressure in the eye, we would recommend the patient take a test on Humphrey's machine. This is a 5-minute test per eye with a series of clicks. And then after the different clicks, the machine prints out a report and tells what is the patient has any peripheral vision. That's vision on the side of the eye. They call glaucoma a thief in the night because before you know it, you can wake up one day and be blind. But some of the telltale signs are you start to lose your peripheral vision. So if you can't see on the side, make sure you go to the doctor and get an eye exam right away. Well, welcome to our surgery room. We are so proud to have a surgery room here at our eye clinic that I like to call the little engine that could. We do several types of surgery. Our number one surgery that we do here is called pterygium. That's a tissue growth over the eyes. It doesn't cause blindness, but it could appear that you're going blind because you can't see. Eyes are usually red, dry, and irritated. It can become even painful. It is thought to have been caused by UV ray exposure, not protecting your eyes with sunglasses, also working outside in, say, construction, landscaping, and perhaps your eyes are being exposed to dust, wind, and dirt, and you don't always clean them. So it's very important every night before going to bed is wash your face with soapy water. Warm soapy water is key. Another type of surgery that we perform here in the eye clinic is called granuloma chalazion. That's a pimple on the eye. Skin tag, the moles you usually see on the neck. Sometimes people have them on their face and around the eyes. We can surgically remove that. Another one of the procedures we perform in our surgery room is called laser treatment, and it's not for cosmetic reasons. Laser treatment is for patients who have diabetic bleeding in the back of the eyes or maybe a torn retina. And what the doctor does here is cauterize the blood to stop the tear from getting larger and also to stop the bleeding. The patient would sit here, they would place their chin here, their forehead here. The doctor would sit in another chair, turn on the machine, and work with the patient and stop the bleeding, stop the tearing in the back of the eye, so the patient can get back to work and be a productive member of our society. As you can see, we have readers and sunglasses for the patient to choose from. After the patient has went through the pre-testing, they've been through their comprehensive eye exam with the doctor, and maybe it's been determined they just need readers. Well, guess what? We have a great collection here. We have plus 2s, plus 2.5s, and so forth and so on. They were all donated by people in the community, just like you, who were so generous to provide this collection for our patients. Say, for example, a patient needs this 1.75. It's all labeled. It's here in the container. They can try them on, look in the mirror, see how they like it. If they can read a magazine and it looks fine, they'll be able to take it. Guess what? Free of charge. We also have sunglasses that the patient can choose from. As you can see here, there's a great collection. The patient could try a pair on, look in the mirror, see how they like it. We have sunglasses for women, children, and men. Very cool collection. So thank you to the public for caring enough to donate sunglasses you don't use anymore to people in the community who need it the most. Guess what? Free of charge. All of our services here are free of charge. Lyons and I would like to say thank you for touring the Florida Lyons Eye Clinic, the little engine that could. We like to think of ourselves as giving the gift of sight. Last year, we gave the gift of sight to over 1,800 patients and performed 84 surgeries in-house. This year, our goal is to do that, but 10% more. That's 189 more patients. Help us cross the finish line as we serve more people in the community, because 80% of vision loss and poor vision can be cured and or prevented. So thank you for your support, and on behalf of the Florida Lyons Eye Clinic Board of Directors and staff, thank you. That's our story, and we're sticking to it. Goodbye.